I got backed up against the wall by a patient that was about 5'1", like this. And he said, "You told me that this would sound exactly like a hearing aid," those words have never been spoken
ever
out of my mouth.
Yeah, even if it was your first day on the job, nobody would ever let somebody believe it's the same thing.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
It's heating up around the country, but we are on fire with this Monday's episode of Ask an Audiologist. That sounded so much cooler in my head. I am Kevin Ziener.
Yeah, and I'm Dr. Michael Squires.
Our topic today is going to tackle the difference between a hearing aid and a cochlear implant, written by Dr. Deanne Rudden of Longmont Hearing and Tinnitus in Longmont, Colorado. Dr. Michael,
yes.
I ask, having a pretty good understanding, but deferring to you still, what is the difference between a cochlear implant and a hearing aid?
This is actually a really good topic because I have a lot of people coming in.
Is that to infer that every other topic is a bad topic?
Oh, for sure.
Got it. Just wanted to make sure.
Yeah. This one's the best.
This is hands down the winner in the clubhouse.
So we do have companies like Cochlear Americas, which is a cochlear implant company. Advanced Bionics, which is another one. They are developing information and advertisements and things like that go out nationally in Reader's Digest, which is great. We're creating some awareness. I really like these articles, but we get a lot of patients coming in with some misunderstanding of what a cochlear implant is. They're saying like, well, I've had hearing aids for 10 years. I'm still not doing that great. I need a cochlear implant. Maybe not. Okay, so let's talk about some of the differences.
It feels like one of the most severe self-diagnoses in the world,
which is,
by the way, it's like,
and you know how I feel about self-diagnosis,
right? Not great. You as every other doctor. I'm not super stoked that you and WebMD told me what I should be doing now.
Yeah, well, that's kind of how it feels. Sometimes we get these patients come in and go, "I want to see you for a cochlear implant." I'm like, well, you might not be a candidate, right? And so hearing aids and cochlear implants work very, very differently past a certain point.
Sure.
Okay, so a hearing aid is going to take an acoustic sound, right? A sound in the environment into microphones, and it passes through various levels of microprocessing. Okay, they are incredibly powerful little computers that have to run off of a very, very small battery. Yeah. So we wonder why these things are so expensive is because there's 4 billion connections on this microprocessing chip, and that's not an exaggeration. Right. So once the sound gets processed through the microprocessing chip, the amplification is added at different channels or bandwidths and yada yada. Then it's turned into an electrical signal that's pushed to a receiver. The receiver is then like a telephone pushing out through a diaphragm an acoustic signal. So in general, that is how a hearing aid works. We go acoustic to an electrical signal, back to an acoustic signal, and then it goes into the ear.
There will be a quiz, so please take notes.
Get your pencils and your college rule.
It's not Dr. Michael today. Paper. It's Professor Michael. Take notes.
Yes.
Continue.
So anyway, cochlear implants. They are going to take in sound very similarly to a hearing aid into the microphones. They are going to turn that into a processed electrical signal, but that's kind of where the similarities stop.
Yeah.
They're going to then submit that electrical signal to what's called a receiver coil, or an RF coil. Radio frequency coil is probably more accurate. It turns an electrical signal into a radio frequency, which is then passed across the skin to an internal component, right? The implant.
Okay.
And so that implant, which is powered by the battery on the external, right?
Yeah.
Talk about science, right?
I'm actually more impressed that you're just, I know you do this, but I'm just so impressed that you're just ripping this off the top of your dome.
Oh, well, I'm also a specialist with cochlear implants. Right. So I work with these things a lot. And so
it's like, I'm just so impressed that you know what your job is. Like I'm
amazing.
Like, wow, we really should ask an audiologist. He knows what he's talking about.
Crazy.
Novel. Yeah.
So now that we're at a radio frequency that's going to be turned back into an electrical signal, but that electrical signal is going to be pushed down into what we call an electrode array.
Sure.
So we have a coil. There are many different types of implants, but let's say on a healthy, typically developing ear that is a candidate for a cochlear implant, there is a coil that has a number of electrodes on those. And those electrodes are little metal bands that push electricity into the auditory system.
Got it.
So those electrodes are assigned a certain frequency range, very similar to a hearing aid with a bandwidth, right?
Yep.
But these electrodes are in charge of a frequency range. And so they're stimulating the tonotopic cells that are responsible for hearing.
Yeah.
But they're nerve cells. And so we're stimulating the auditory nerve fibers so that information can be carried to the brain.
So, and I think obviously clearly in the way you described hearing aids and the way you described implants, it's a very different path to get the sound to the individual, which means it's a different noise sound outcome than
that's fair.
Than what a hearing aid produces as opposed to what a cochlear implant
that's
produces.
completely fair. In fact, I got backed up against the wall by a patient that was about 5'1", like this, and he said, "You told me that this would sound exactly like a hearing aid," which those words have never been spoken
ever
out of my mouth.
Yeah, even if it was your first day on the job, nobody would ever let somebody believe it's the same thing.
And he was one of my first cochlear implant patients. And so I realized at the time that I have to be very diligent in my explanation of what a patient can expect.
Right.
Okay. So I go like deep in the weeds as it is right now, because I want that patient to understand that even though they've worn hearing aids for 25 years or whatever the case is, we're working with a much different system.
Totally.
In a cochlear implant than we are with a hearing aid.
Right.
And so what we can expect in terms of what your brain is interpreting is very, very different.
Right.
So oftentimes a patient will tell me that, once we activate the device, whether that's over the course of 1 day or 2 days, some clinics do it 2 days. We see patients in our clinic back on the first day where we activate, and then we see them a week later, a month later, 3 months, 6 months. So there's a lot of follow-up that's required. But what I try to prepare that patient for is we don't know what they're going to hear.
Well, and
we don't know what it's going to be. It might sound squeaky. It might sound like Mickey Mouse. It could be like beeps and boops. It could sound like bells. We have to see how the auditory system is going to react to what electrical information we're putting in there, and then we know how to adjust it.
But my only frame of reference, and I'm sure a lot of people's who are cinephiles, is The Sound of Metal, that movie, where a drummer goes through sudden onset hearing loss, sudden deafness, tries to kind of cope in a world without sound, and then ultimately lands on getting a cochlear implant. Now, his experience, which again is not uniform for everybody, is it's more of a robotic metallic sound where you're able to hear noise, but it's like if you're hearing a transmission of a walkie-talkie through another walkie-talkie, it's like kind of staticky. Now, again, that is probably unique to that storyline, but it's not like, and now the world around me sounds the exact same.
Yeah, it's amazing. I can hear everything crystal clear. But I've seen everything on a spectrum from this is terrible, I wish I didn't do it, which is generally we didn't follow up, we didn't do our oral rehabilitation like we were expected to do. We didn't do some things.
Right. We just took it at face value and we didn't like it.
All the way through, my oldest patient that I've ever had with a cochlear implant was 92 or 93.
When they received it?
When they got it.
Wow.
I activated her and she said, "This is amazing. I can hear you crystal clear." And I was like, "No, you can't." She goes, "Test me." And so I did every manner of possible functional testing that I possibly could. She could understand every single thing.
No way. That's awesome.
On the first day.
Cool.
Which is an anomaly, right? And I have patients with who have had one implant and they decided to go back and get another one, and they're doing wonderfully. Pre-implantation, their speech understanding is 10, 16%, and those are guesses. Wow. Now they're at 99%.
Incredible.
Post-implantation. So
cool.
Really, it's all about communication. It's not about, hey, can you hear a bird chirping from 100 yards away?
Right.
This is, can you understand what I'm saying and have normal communication with your family and loved ones?
So, I mean, again, kind of quickly, how should somebody go about determining whether or not a cochlear implant is right for them? So
this is something that I'm trying to get out. It's really about education. So really get on and read as much as you can. As the consumer, educate yourself so that you know the right questions to ask, so that when you go to your primary care physician, you can ask them, do you know of any implant centers?
Got it.
That you could refer me to. Do you know of any audiologists that work with cochlear implants? Because what we have found is an audiologist that's knowledgeable about cochlear implants doesn't necessarily have to do cochlear implants in their center. They will know where to refer you.
Got it.
But there are many, 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 many providers that don't know where to send you, don't know what to do with that. Like, well, I don't know what to do about a cochlear implant, right? Make sure that you are finding an implant sender and call and ask them. You know, even if they're not near you, you might call and say like, "Hey, I'm curious about a cochlear implant. Where should I start?"
Got it.
If you don't have the resources locally.
Got it. Makes sense. Your note is to trust a professional.
Always.
Trust us, but trust somebody who's, actually in front of you too.
Who's close by.
Right. I mean, don't trust me. Trust him. He's the professional. Ask an audiologist, not ask the other host. And now that you are appropriately educated on today's topic, we encourage you to continue your hearing education pursuits by visiting us at askanaudiologist.com for all your audiology needs. A stupendous lesson today, courtesy of Dr. Michael. Thank you.
Thanks, Kevin. The hosting, top notch.
I'm just still reeling from months ago when our producer gave me a C-. I've tried to bring my A game every day since, and I've yet to get it past a B.
It feels like it was just a couple minutes ago.
I'm telling you, man, it still haunts me till this day.
It stings like it was an hour ago.
Sure does. We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
Makes sense to me to only ever want something that's rechargeable. Like if I have to manually remove stuff from my listening device, I'm going to go crazy because I am an entitled millennial and I want everything to just work seamlessly right out of the box.